Well, I am.
You're on the record, sir.
Okay, good morning. Today's Tuesday, August 10th. Time is 9 o'clock. The board is in session to conduct its weekly open business meeting. All three commissioners are present. Also with us, if you'd introduce yourself, we'll start right over here. New York Times guy,
Mike Baker.
Mike Baker.
Kyle Land, statesman.
John Blake, paramedics.
Bonnie Overbelly, Recorder's Office.
Tim Klein, Treasurer's Office. Mike Work, Operations.
Richard Beck, Development Services.
Selena O'Neill, Operations. Heather McCarthy, Prosecutor's Office.
Communications?
IT guy. Yeah, and we have our distinguished assessor, Bob McQuaid, and our distinguished treasurer, Beth Mon. So, are there changes to the agenda, Madam Clerk?
No, sir.
Mr. Chair, I'd like to make a motion to modify the agenda to move the volunteer appointment to the Central District Health Board to the end of the agenda to allow for hopefully a robust conversation. And that way staff that needs to get back to their offices, they can do that. So we'll try to quickly go through the regular agenda and have plenty of time for that discussion.
I think that's a good idea. Is there a second to the motion?
Second that.
Okay, you've heard the motion. All in favor, say aye. Aye.
Aye.
Aye?
It's been changed. Okay. So we have new business. Operation change order number 1. Ada County Juvenile Service domestic water pipe replacement. Do we have anybody who wants to talk about that? Okay, there you go.
Hi, Mike. How are you?
Mr. Chair, Commissioners, I'm doing good.
Good.
So this is for the Juvenile Services Water Pipe Replacement Project. Over the course of the past year, we kicked this project off a year ago. We have run into a few hurdles which we've been able to cross with the contingency allowance that was in the original contract amount. However, we did come across some final things here. We need some recirculation pumps, and so we're wanting to increase the final contract price in the amount of $1,523.87, and we do have the funding to do that in-house, and this will finish out the project.
Okay.
Yes, finally be done.
Yeah, they're anxious to get that finished, yeah.
And so they'll be able to get water right in their cells now.
Yes, finally.
Yeah.
Yeah,
Walk
we
it
are really close to
All right.
having that all wrapped up.
All right, well,
So
good.
we just need your approval.
All right,
Okay, Mr.
well,
Chair, I'll make the motion.
Okay,
Yes, I move to approve change order number 1 as identified on the agenda and authorize the chair to sign the documents on behalf of the board.
I'll second that.
okay, you've heard the motion. All in favor, say aye. Aye.
Aye.
Aye,
Motion carries.
Thank you very
Thank you.
much.
thank you.
Okay, next up, we have catering permits. For an event at Mint Barrel Barn, we need some additional information from our development services staff.
Yes, good
Morning,
morning,
Richard.
Mr. Chairman, Commissioners. I'm just pleased to be able to report this morning that the owners of Mid Barrel have been able to meet all requirements, satisfy zoning and building requirements, and have been able to secure all approvals necessary to operate as an event center. So they're good to proceed.
Excellent.
Okay. Well, I'll entertain a motion.
Mr. Chair, I move to approve the catering permit for O'Michael's Pub and Grill at Mint Barrel Barn. And authorize the chair to sign the documents on behalf of the board.
I'll second that.
You've heard the motion. All in favor, say aye. Aye.
Aye.
Aye,
Motion carries. We have, and now we'll take up the remaining licenses, which include a catering permit and a license application. Is there any discussion?
yes, no discussion, but I'll go ahead and make the motion.
Okay,
Yes, I move to approve the catering permit and the remaining licenses as listed on the agenda, including the 1 catering permit, 1 license application, authorize the chair to sign the documents on behalf of the board.
is there a second to the motion?
I will second the motion.
It's been, you've heard the motion. All in favor, say aye. Aye.
Aye.
Aye,
Motion carries. Okay, clerk's office. Phil's not here. Who's here from the clerk's office? I guess we don't have anybody here from the clerk's office, so we'll move on. We'll move on. Next up is our claims journal. May I have a motion in the claims journal?
Well, Mr. Chairman, I move to authorize payment of claims on the Claims Journal dated August 6, 2021.
I'll second that.
You've heard the motion, all in favor say aye. Aye.
Right?
Aye.
Motion carries. Next up are personnel, actions. Do I have a motion?
Yes, Mr. Chair, I believe we've all reviewed those, and so I'll move to go ahead and approve the personnel actions as listed on the agenda, and that the summary sheet remain in file in the Commissioner's office.
Second the motion.
You've heard the motion, all in favor say aye. Aye.
Right?
Aye.
Motion carries. We have our distinguished assessor Bob McQuaid for updates and for. Go ahead.
Mr. Chairman, just a couple of things. We have 16 appeals filed to the Board of Tax Appeals so far, and there's less than a week left of time to file for the appeal. I would also note that the next item on the agenda, the tax cancellations, we have 91. Probably 95% of those are homeowners exemptions that have applied after the roll had closed. We thought there would be maybe about 250 to 300, this was years ago, for the entire year, but this is just a little over halfway through, and we have almost 200 of these tax cancellations so far, so it's more burdensome than we had anticipated.
Okay, is there a deadline on that?
December 31st, Mr. Chairman.
Also, they can file clear up to the end of the year?
Yes.
Okay.
Yes,
Okay,
that's everything from the assessor's office.
all right, well, we have, these, tax cancellations.
Yes, Mr. Chair.
Yes.
And just a note for the record, for the public, these are not really necessarily tax cancellations or tax modifications. And with that, I will go ahead and move to approve the 91 tax cancellations, i.e. modifications as listed on the agenda, and authorize the chair to sign the documents on behalf of the board.
I will second that motion.
Yes, and I thank you for clarifying that. These are not actually tax cancellations, but we are required by the code to use that term. These are adjustments, and most of these, in fact, they're all homeowner, adjustments. All right. You've heard the motion. All in favor say aye. Aye.
Right?
Aye.
Motion carries. Treasurer's office. We have a treasurer with us.
Good morning.
Good morning.
I will just note before we get into the monthly financial report, we will be tracking these tax cancellations or tax adjustments very carefully. As the assessor noted, this is more burdensome than we perhaps realized initially. And what that means for our office is that first week of November is gonna be crunch time. A lot of these we cannot process until the levies are set. And then once we have all the additional data from the tax commission, certified values, once all of that is in, then it'll be kind of go time for us to process all of these. So we're not able to take action on these at this time because they are for the 2021 tax year. But we will be tracking them carefully in terms of both quantity and then also the amount of that is being adjusted off. Just to track the impacts of this legislation and how it might be affecting our offices and the taxing districts.
Are these tax cancellations, they are primarily the homeowner's exemption? Are the properties they moved from, are they removed, is homeowner's exemption removed from those properties?
Mr. Chairman, in Ada County, they are not removed. We keep them, if it occurs prior to April 15th, we take them off, but at this point in time, we leave it on the existing property.
Okay. Okay, Tim?
Mr. Chair, Commissioners, I'm just here to review the July investment portfolio. We did have a couple of changes in July versus last month. We did make another purchase with a mortgage-backed security of approximately $4 million. And we did have one agency bond was called, which I believe is our last callable bond. The rest of the agencies we hold should go to maturity now unless for whatever reason we decided to sell. That was about 1.9 million. I've listed the exception items, balancing exception items between us and the clerk's office since we balance daily to them. We did have a few at month end.
The largest one was simply an ACH payment, which it happened on the 30th, which was the last business day of the month. And those ACH items, they're always on there for one day. So the biggest one was just a one-day normal exception. The others have to do with the Ada Central payroll issue that we're working through. So there was nothing really significant. We still have, of the 90-some thousand dollars worth of checks that we had to reissue, all of those have been processed, except for two, which is total $1,320. So we're making headway with that. So no big concerns with balancing. We're still working through the Ada Central fab communication issue, but I think we've got a handle on that pretty well.
Mr. Chair?
Yes.
What's our cap for LGIP maximum? Is it 70%?
I don't believe we have a cap.
We don't
anymore.
have any cap at all? Okay. I thought we had in the policy.
We
We have
did
a
have,
policy,
in the prior policy is 70% cap.
it was, so when we revised the policy, we took that cap out.
Yeah, we did that September 15th, 2020. We revised the policy, and we don't have a limit on LGIP. I don't think we'd ever see us maybe go over that, but
Okay.
All
It
right.
just goes up a little bit. It seems like it was at 58, now it's at 61. So.
yeah, and primarily the reason for that was once we did the distribution for the tax collection period, the county held on to about 21% of all of that money, and so it was in LGIP at the time.
Oh, okay.
And so that's the big difference there.
Yeah, thank you.
Are there any other questions from the commissioners? Do you have a question?
No.
Okay. I don't have any questions.
Thank you.
Thank you, appreciate that. Okay, next up, we have the approval of the minutes. May I have a motion?
Yes, Mr. Chair, I move to approve the minutes as identified on the agenda and authorize the chair to sign the documents on behalf of the board.
I'll second that.
Okay, you've heard the motion. All in favor, say aye. Aye.
Aye.
Motion carries. Okay, we have grant awards from the Public Defense Commission. Is there a discussion on the grant awards?
Mr. Chair, Director Geddes is here, and he might want to speak to this a little bit. This is a very
It's a
healthy grant from
it's a
the
pretty healthy grant, all
Commission
right.
for $1,359,568.
Yes,
Mr. Chairman, Commissioners,
Sure.
thank you. They gave us our full allotment this year, which is good. They haven't done that recently, so we're very pleased by this. Just for your information, I hired 10 additional staff with that grant, 7 attorneys, 2 investigators and a legal assistant. It also funds almost all of our travel and training, our death penalty courses that we send people to, and a variety of other things. So it's a robust grant that really helps us carry out our mission in a much more fundamental way. So very, very pleased to get this grant.
okay, and it's, the grant period starts in October, correct? Our first, okay, good enough. All right, do we have a motion?
So, Mr. Chair, I move to approve the grant. It is number 2105-B, as listed on the agenda, and authorize the chair to sign the documents on behalf of the board.
I'll second that motion.
Okay, you've heard the motion. Is there any further discussion? Hearing none, all in favor say aye. Aye.
Aye.
Aye.
Motion carries. Thank you, Tony. Yeah. Development Services, recertification of compliance with the FEMA, Federal Emergency Management Agency's Community Rating System for the National Floodplain Insurance Program. Do we have any discussion on that?
Richard?
Richard?
Thank you, Mr. Chairman. Commissioners, yes, this is just a request for the board's signature on a recertification form that we do each year for the National Flood Insurance Program. So it's an opportunity for us to certify to the FEMA that we're continuing to take steps to mitigate flood risk in the county and qualify our residents to be able to participate in the National Flood Insurance Program. So,
Great. And part of us redoing the bridge out in, what road was that, Linder?
the Is that the Highway 16 bridge?
No, it was another bridge that we had to redo, I think 2 years ago to come up to standards, but anyway, we fixed what we needed to fix,
Yes.
so, yeah, this is an important program. All right, Mr. Chair.
Did it have
I'll
a
go
carve out for a big salt pile?
ahead. Salt
I'm just
shed.
Salt dissolves, just,
Okay.
We can't let that one go, can we?
No, we can't. All right.
I'll move to authorize the chair to sign this recertification of compliance with the Federal Emergency Management Agency as listed on the agenda.
I'll second that.
You've heard the
Thanks.
motion. Is there further discussion? All those in favor say aye. Aye.
Aye.
Aye.
Motion carries. Barber Park Event Center has 2 events. Are there questions or discussions on the 2 events? There's a,
I'll make a motion.
okay,
I move to approve the 2 Barber Park Education and Event Center agreements as listed on the agenda and authorize the chair to sign the documents on behalf of the board.
I'll second that.
you've heard the motion. Hearing no further discussion, all in favor say aye. Aye.
Aye.
Aye.
Motion carries. Now we have a notice of a lien and 2 releases of liens for weed and pest. Is there any discussion? If not, I'll entertain a motion.
Mr. Chair, I move to approve 1 notice of lien and 2 releases of liens for weed and pest as listed on the agenda, and authorize the chair to sign the documents on behalf of the board.
I'll second that.
You've heard the motion. All in favor, say aye.
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 Motion carries. We have 16 agreements. I've read most of them, and I did have a question on one. Do we have anybody here to talk about the
Renewable energy credits?
yeah,
How did I know?
the rec?
I can read his mind now. Hi, Selena.
Hi, good morning.
Aye.
Good morning, Mr. Chair. Thank you for this opportunity
Sure.
to discuss this with you. This is a renewal of a 5-year agreement we have with Idaho Power for the purchase of RECs. Since we began in 2019, we had a different board, so I do appreciate this opportunity to kind of explain this to you. I did provide some notes with the agreement. I can go ahead and go through them quickly and add some more comments and try to answer your questions, but basically, in order to meet Ada County's goal of 100% clean energy as outlined in Resolution 2461, we entered into this multi-year agreement. Because only 40% of Idaho Power's electricity is currently carbon-free, the other 60% is attained through renewable energy credits. Ada County demonstrates leadership by continuing to use 100% clean electricity for government operations as it has since 2020 by signing this agreement. By choosing 100% clean electricity for all county-owned buildings, our carbon footprint is reduced by 8,426 tons of carbon dioxide, the equivalent of removing 1,626 vehicles from the road. Proceeds from Idaho Power's rec sales go toward offsetting their power supply costs to keep energy prices as low as possible. Investing in a local clean energy market is good for all citizens of Ada County. I have some additional information if you'd like me to expand on this.
Well, what I'm interested in is the cost.
Okay, so the cost, Ada County spends nearly $1.5 million on energy every year for over 1.3 million square feet of buildings. Of that, 104,000 per month is for electricity. In order to meet our clean energy goal, as in Resolution 2461, we purchase renewable energy credits at a monthly cost of $892, or 0.7% of our annual electricity costs. So for this fairly nominal amount, we have 100% clean electricity for all Ada County operations.
So it's $800 a month.
892,
So it's roughly 900 a month. So how much is that?
10,700 per year.
Okay.
It's a bargain.
I have lots of numbers.
$10,700. Now, don't we? And I haven't quite myself figured out how this actually works because we have we generate some RECs at the landfill, correct?
Correct. And I have some information on that. So the landfill recs sell for $6.50. Idaho Powers sell for $1. So if we actually save $51,000 by not using the landfill recs because we earn that revenue from the sale of those recs. So we started to use the landfill recs the first year initially, and then we found a better option through Idaho Power and realized that we would come out better by purchasing them at a lower cost than what we were selling them for. Buy low, sell high.
No, I don't quite get that.
Would you like me to explain that again?
Yeah,
Okay.
we generate some wrecks at the landfill.
We do.
And we don't sell them.
No, first of all, we don't own them.
Who does?
The LFG, because they
Yeah.
they own the engines, they have the rights to the wrecks. We have an agreement where we earn 40% of the sale of those wrecks. And they get to set the price on what they sell them for. And so
What are they selling for?
they sell them for $6.50.
We get 40% of that,
Correct. So we earn
And how
about
much money?
$50,000 a year.
and that's about 50,000.
Correct.
Okay, that we generate,
That we earn.
comes to Ada County. Okay, go ahead.
And so by purchasing from Idaho Power for $10,000, we're still coming out ahead, by not losing that revenue, still earning that revenue from the landfill recs, and then we also get the claim of 100% clean electricity for county
So
operations.
we get $50,000 from the company that generates the electricity at the landfill.
Right,
And then we take 10,000 of that and
Right.
supplement and so it really doesn't save any, or we don't
correct,
produce less carbon, yet we just say we do.
right. We don't,
No, it's more complicated
It
than
is,
that.
and-
There's mitigation banks and credits, and we probably need to have
I do,
a
and-
separate discussion with maybe even Idaho Power's rec expert sitting at the table, because it's a fairly complicated
right.
system.
Thank you. I was gonna suggest that as well. A couple of years ago, our sustainability specialist and I made a presentation to the board about clean energy, when we chose to go down this path. And that might be, something that would be beneficial before we make a decision here today.
Okay, I like going along with that. So what that means is we need to table this for a future date then.
Correct. There is a time frame for Idaho Power to have that agreement,
What's their time frame?
August 31st.
Oh, so anytime this month then.
Okay.
All right. Well, I think that's a good idea. Thanks for making that recommendation.
Okay, thank you.
We can get more information because it's more complicated. That's the reason I brought it up. What's this about?
Okay.
So, is there a motion on tabling this particular agreement?
Mr. Chair, I'll go ahead and move to approve 15 agreements on the list, as listed on the agenda, and table agreement number 13810-3-21 to probably sometime next week before August
Great.
31st. Okay.
Well, when we can, yeah.
Yep, and authorize the chair to sign the appropriate documents on behalf of the board.
So did you table that to a date specific?
Yeah, can you want to give me a date?
Yes.
What's the date that we'll have to get the Idaho Power people here, whoever it is that comes.
Sure.
Tells us about
But
it.
we
You
can
wanna-
put this on
I was
the,
gonna say, or you can pull it off and then we can just put it back on when.
well, let's go ahead and put it back on the Tuesday of OBM before it expires.
Okay,
And when's it expire? I'm sorry.
End of August,
correct.
So do you wanna do the 24th or 31st?
24th.
24th is better.
Yeah, so I make the motion, amend the motion to table it to the 24th of August.
And to approve the rest of the rest of the
yeah,
agreements.
yeah.
Okay, is there a second to that motion?
One question on number D, what is the workspace located at 417 South Sixth? Is that Boise Police Station?
Commissioners, that's Faces.
Okay,
that's Faces, yeah.
Faces.
so we lease out some office there for the sheriffs to,
No,
Deputy.
it's
Boise Police.
Boise PD.
okay, I see. All right, thank you, I will go ahead and second the motion.
Okay, you've heard the motion. Is there further discussion? If not, all in favor say aye. Aye.
Aye.
Aye.
Motion carries. And finally, we have a Compass non-binding letter of intent. This project was approved during our budget deliberation. Intent to commit funding and participate in the acquisition of digital something.
Orthophotography.
Orthophotography.
And that's not of your foot.
And associated data.
Yes, Mr. Chair, this is the agreement. I don't know what kind of technology it is, Bob, but it doesn't have anything to do with orthopedics.
Mr. Chairman, I could just make a quick comment
Okay.
about this. These are the digital images that we use for our maps and for our appraisal work. Compass acts as the agent for all of the other participating agencies such as Boise City, Meridian, Idaho Power, all of those. And, this is just an agreement for that.
Okay. May I have a motion?
Mr. Chair, I move to,
Will you make
there
it?
it is.
I'll move to authorize the chair to sign the Compass non-binding letter of intent as identified on the agenda.
And second that.
Is there further discussion? Hearing none, all in favor, say aye.
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 Aye, motion carries. We now have, anybody that doesn't want to stick around for this, you can take off if you want to. We now have yesterday, the board conducted interviews for the Central District Board of Health. Is there discussion?
Well, Mr. Chair, maybe I'll kick it off. I was very thankful that we had 3 qualified doctors to step forward for this position. We actually had more than just those 3 applicants. We had several people who applied, but under Idaho code, one has to be a medical doctor to fill that position. The doctor does not necessarily have to come from Ada County. It can come from anywhere in the 4 counties, is my understanding. But since we're the larger county, we probably have more doctors here who are available to apply for that position. I think I was impressed with all 3. I don't really like this process because I hate turning people away when they do want to volunteer for the county. You know, you kind of hope that everybody could walk away with a position. So I do feel bad that in all these appointments, when you have to turn people down who want to serve. I think all 3 bring a slightly different perspective to the issues of the day. I am definitely leaning towards Dr. Cole. I was really impressed with his interview. I recognize the fact that he's a bit of an outsider, and as I said previously, I respect that because I consider myself an outsider, and I think it may be valuable to bring a different point of view. Every single government that has to deal with the pandemic from the county level to the state level to the federal level. We have thousands of volunteers and doctors and paid employees who are working on this pandemic. I think we would benefit from somebody who is just, doesn't necessarily always toe the company line. The CDC has, been proven to not been 100% correct on every single issue related to the pandemic, and of course that's going to happen because the disease is evolving, and so things need to change as the disease evolves. I don't think the federal government has done a great job in messaging this pandemic as a whole. And the fact that we only have 60% vaccination rates probably demonstrates that for me. So I think having a different viewpoint, somebody that can speak to the people who maybe have vaccine hesitancy in Ada County is a good option. We have status quo people across the state, across the country. We're just gonna toe the CDC line, but I am kind of interested in somebody who may go a different direction. And when the pandemic is over, we still have a lot of different things to deal with as far as community health goes. And I think he would be a pretty good person to bring public education to the public. He seemed to have a good presence, a good ability to communicate. He seems to have some experience with that at the national level. We brought up nutrition, physical fitness for children, elementary school. The statesman didn't seem to think that was a great discussion, but that's a major issue in our country that needs to be addressed. And I think Dr. Cole, he actually talked about that particular issue that it comes down to a diet is a major part of public health, and I don't think we do a great job in messaging that to the public. So those are my initial thoughts on the subject, Mr. Chairman.
Thank you, Commissioner Kenyon.
Thank you, Mr. Chair. I too thought all three candidates were very qualified, professional. I really appreciated hearing from all three, and I think that we're lucky that we had so much interest in this position. And for me, it just sort of boils down to this is the medical position, the medical appointment for this board, and so they're going to be relying heavily on this person's opinion and relationships and expertise. And because of that, I just think it's really important to pick someone who has a reputation in the community with the medical community that is where they have the trust and confidence, and I think that's with Dr. Blue. I think that with all the letters that we ended up getting a lot of input on this position, obviously, but I really look at this is a medical position. What does the medical community have to say? And the medical community spoke loud and clear supporting Dr. Blue and listed numerous reasons, and that's from the St. Luke's system, St. Alphonsus, Primary Health, Ada County Medical Society, and these are non-political groups. These are medical groups, and then also, in addition to the Idaho Medical Society, just yesterday we received a letter of support for Dr. Blue from the chief of staff at the VA Medical Hospital. So, to me, that speaks loudly, and I agree with Commissioner Davidson that it's nice to have an outsider have that input and that perspective. But I think for this particular position, I'm not sure that would do us all justice because we have to serve the entire community. And we have to work very closely with all of these medical hospitals and systems and partners. And so I think there's a place for that. I just don't think it's on this particular board. And then I do think, I really respect Dr. Cole, that there have been significant concerns with medical professionals and in the medical community about statements that he's made and treatments that he has been giving patients that raises more than a few eyebrows. And so I think that, again, I don't think we need a lot of controversy in this position. So I would love to see us appoint Dr. Blue for the position. Again, I think for all the reasons I mentioned, he's the most qualified, has the best relationship in the community with our medical community. But I would really encourage us to reach out to Dr. Cole and have him advise us as a board and advise Dr. Blue when it comes to some of these issues, because I do think that he and actually all three candidates bring so much to the table, so I would love to see them all kind of work together on this. But in terms of the appointment, I would say Dr. Blue fits all the boxes, checks all the boxes, and being one of the top epidemiologists, infectious disease doctors. With COVID, he's best suited to manage the pandemic right now as well.
Thank you.
Mr. Chair?
Well, I think I want to make a statement.
You want to make a statement?
Before we proceed, I wanted to listened to both you and Commissioner Kenyon. And this whole process has been somewhat frustrating to me because of the politicization of the process. It started out with all three of us signed I thought, a very gracious letter to Dr. Epperly, suggesting that, thanking him for his service. He'd been on the board for 15 years. And the local press just went berserko, saying that we sacked him or squeezed him out, things like that, which we didn't. I went and looked through my records, and I couldn't see a single spot or anything where Dr. Epperly had even wanted to be reappointed. I mean, maybe he did, I don't know, but he didn't notify me. I don't know if he notified you or you, but I didn't see any notification there. And the press has just gone crazy over this and politicized it. And I have to say this in terms of the politicization of this appointment, and that's why it's been increasingly frustrating to me. I did not know the political affiliation of any of these three individuals until the press put it in their paper and on TV. I did not know that. And so talk about politicization. Didn't come from us, came from the press. Thank you very much. It's just been frustrating to me and actually troubling. But now getting on to the business. I too am pleased that we had three very highly qualified individuals for this position. And I checked on the law, and House Bill 316 changed the law. And you might recall in January when we had a previous appointment up for a vacancy, the law then said, no more than one member shall be appointed from any professional or special interest group. Well, we interpreted that to mean that only one doctor could be on the board. Well, that law's changed. And with 316, the legislature deleted that section of the code. And so I think that we've benefited by having three very highly qualified doctors. And no matter who we appoint today, there may be openings coming up on that board, and we could actually reach out to any one of the three that we didn't appoint and get them to fill that position. And I think that's a good thing. We could have more than one doctor on the board, in other words, and I'm glad that the legislature did that. Now, as it relates to the COVID thing, fortunately, we didn't spend all of our interview time visiting about this COVID variant and the variant. We did talk about it a little bit. Well, I went and looked up a study that had been done recently. It's done by the Kaiser Foundation. And this was done in June. And they surveyed, I don't know how many people they surveyed, but it was just people who had not received a vaccine, had decided not to get vaccinated. And then they asked them a question, will more likely to get vaccinated if this happened or this happened or this happened. And the highest response, 46% of those that had not been vaccinated, said that they would be more likely to get vaccinated if it was their doctor that recommended it to them. 46% of them. 44% said that the vaccines currently authorized for emergency use received full approval from the FDA. There's those two items that are preventing a lot of people from getting vaccinated. It's not fully approved by the FDA. It's approved for emergency uses, but not fully approved. But the biggest percentage was if their doctor approved them. You may recall I asked each one of the candidates which is most important, advice from the Central District Health or advice from their doctors. Now, Dr. Blue, he kind of had a difficult time with it, but he ended up at the right spot, which was your doctor. The other two, Dr. Moss and Dr. Cole, were instantly, okay, it's your doctor, no question. And this survey establishes that. So if we want to up the immune rate in Ada County, it's not through the Central District Health. It's through encouraging people to go to their doctor and seek advice from their doctor. And that's what many of us have been saying all along. Now, one thing that did disappoint me about the three, none of them had looked at the budget of the Central District Health. And that's one of the biggest things they do on the board, is look at the budget. And that's why I was kind of looking for a doctor that would have some budget experience, that would have some experience with running a large organization. Now, Dr. Moss mentioned his affiliation with the Boy Scouts. That's a nonprofit organization. It's a fairly large organization, but I'm not sure how that would play into it. Dr. Blue indicated that they have 9 employees, and there's 7 of the doctors that run it. Dr. Cole, he runs this Cole Diagnostic. He has 80 employees, and he does budgets and so forth for 80 employees, and so that did make that swung a little bit, because in all honesty, this position is for running an organization. It's for and it's mainly budgets. I've talked to several of the board members. They talk about policy, but they mainly deal with budgets, keeping the organization in line with their budgets. That's kind of what we do here. Make sure that Tony keeps his budget in line, that Beth and or Bob keeps your budgets in line, and I looked through at some of the what do they actually do at the Central District Health. And maybe you ought to take a look at what all they do. It wasn't just until last year that they even had anything to do with a coronavirus. It was last year they were given the duty to take a look at it. But you ought to take a look at some of the things they do. I mean, Millennium Fund tobacco use prevention, prescription drug prevention, WIC. How many of you knew that they deal with WIC? That's one of the big areas they deal with, WIC. We've asked them to get a little large, because they actually are involved in when a child doesn't have a place to go.
Foster care.
Foster care, yeah, they're involved in foster care. How many of you knew that? They're involved in foster care. We've asked them to beef that up a little bit, because they're actually sort of in charge of foster care for this area. They look at the foster care program, how it's been working, and they make recommendations to the state of Idaho on foster care. They do. They inspect all the restaurants. They inspect the septic systems. They family health and services, and preventive health, general immunizations. They do immunizations. They even do dental work. The WIC program is a big program that they do. It's $1.3 million of their budget is WIC. So they do a lot of STD prevention. There's a lot of money goes into that. Reproductive health, HIV, clinical testing. But this COVID is a small portion of what they actually do. And we've established that to get a higher immunization rate, it's coming from people's local doctors, from the doctors that they visit with. That's where the highest percentage of getting increased vaccinations is if the local doctors will step it up and ask their patients to receive an immunization. It doesn't come from the health board. It doesn't come from even policies of the health board. Now, I think since last year, the board out there had a lot of trouble, because they were not used to dealing with all the publicity that came along with the COVID. They had giant protests in front of their offices, and they actually violated the open meeting law on several occasions, and they corrected that. And we haven't had any of those problems. Now, part of it is because there's been a decrease, but so I'm still kind of open. But I thought we were fortunate that we had 3 highly qualified doctors. I don't think that that is it paramount that we appoint an epidemiologist to be appointed? Well, maybe. There's lots of epidemiologists. There's several. Dr. Hahn from the state level is available. There's Dr. Epperly served for 15 years. He wasn't an epidemiologist. He was a family practitioner. It's nice that we follow the science, but the science includes all kinds of things. It includes your general overall health. So I am again. I'm pretty much open, but I want to make the discussion. And I believe, in fact, in January, we asked Dr. Blue if he would provide his expertise to the board if he was called on for epidemiology. There's a state expert in epidemiology, and he said yes, he would. And the same with the state's epidemiologist. So I'm not sure that is a reason to just zero in on one person. But anyway, I'm open for discussion. I was disappointed that none of them had looked at the budget. Central District Health. Not even one of them. That disappointed me.
Yeah, Mr. Chair.
Yes.
I agree. Just being an epidemiologist doesn't make or break it for this position. Like you mentioned, if you look at the position as a whole, there's a lot of things that go into this, and it's a 5-year term. It's a big commitment. So, I'm really looking for someone, again, who has those deep, trusted relationships with our medical community, because most of what the CD, Central District Health does has to do with medical-based issues or health-related issues. And so I think without having those relationships and those trusted relationships, I think that we might be setting this board up to possibly struggle in the future with someone that is sort of, like Commissioner Davidson said, an outlier, an outsider who has different perspectives and different ways of looking at things. And again, I think that brings value to the table, but not for this particular position. And I would personally feel that we are not listening to our medical community if we appointed someone other than the candidate that they got behind Dr. Blue. And again, we just received from the Chief of Staff this morning a letter from the VA Medical that was sent to us by Dave Leroy. And in that letter, there were some comments that I think we need to look at. And I think the medical community does question Dr. Cole, and at times it questions things that he's said and some actions that he's taken. And I can read right from this letter that David Leroy sent over, and it says, Dr. Cole has been spreading flagrant mistruths about COVID-19 vaccines, making headline-grabbing but unfounded claims that the vaccines cause cancer. Dr. Cole's public statements, in his view and from perspective of independent fact-checkers, have been reckless. He has endangered the health of Idahoans by touting conspiracy theories, not backed by facts. He's concerned that he will perpetuate these and other falsehoods as a member of the board. And in short, Dr. Cole would deprive the board of an accurate appraisal of the state and medical science needed to fulfill its mission to promote and protect health in our communities. Again, I appreciate someone from the outside that can bring a different perspective to the table. However, in light of the concerns, and it's more than a few raised eyebrows, that the medical community, our medical community, has sent us, I think, a loud and clear message that Dr. Blue is absolutely the best candidate for this position.
Mr. Chair,
Yes.
we certainly have heard from the medical community, but we've heard from the voters as well. And I believe as of present, approximately 90% of the emails or messages we've received from the public have been in favor of Dr. Cole. And so I think that is certainly something to take into consideration. I want to talk about the word politics or politicization, since that's been brought up quite a bit. I'm trying to understand what exactly is the basis of that, because as I mentioned in my questioning, there's two sides of the coin here. There's science, and then there's the policy side, which is what we do about the science. Now, if that's politicization, then, well, that's It is what it is. This is a body, and this is a seat that will have policy-making positions and power. So I was very clear in my public statements about why I did not support Dr. Epperly for another term after 15 or 20 years. It was largely because of the policy decisions that he made on the board, along with other board members, that I felt were an extreme overreaction and a violation of our citizens' individual rights and freedoms. We look over to Canyon County in the Southwest Health District. They went a different route. They didn't have the lockdowns and the mask mandates, and their district is in no worse shape than ours. So having this one uniform message and policy obviously is not a good idea, because we can contrast different states, different districts, different counties that went completely different directions. And there's no proof that any of the mandates had the effect that people would want. Medicine is a science, governing is an art. And it is always tempting for people in power to use the heavy hand of government to try to accomplish their objectives, even on the public health level. And we see that they don't work. Again, 60% vaccination rates. I think when you start introducing to people the threat of government violence, of arrests, of taking their business, etc., people tend to dig their heels in. And so I think that our Central District Health failed in their duty because they did not understand the political side of the issue. And Dr. Epperly was a part of that. In interviewing Dr. Blue, I did not get a good sense that he had a deep appreciation for individual rights the way the other two doctors did. And he couldn't say with any certainty that incarceration and threat of incarceration will not be off the table. I think once you start threatening to put people in jail, a certain percentage of the population will tune out. With respect to our local medical industry as a whole, I am very concerned that they are going down the similar path that the government has gone by attempting to force all of their employees to be vaccinated under threat of termination. And this is now causing a lot of new protests. A lot of medical personnel do not want to be forced into this corner to keep their job. This is something that the legislature may eventually have to deal with, but again, I see now our medical industry going down the same road that the government has gone down, and I don't think it's a great path. I don't think threatening people's jobs is the best way to go on this situation. And so I worry that if Dr. Blue does get in there, then the power of the local health industry to put our medical workers, our nurses, or doctors, or staffs at hospital into a very bad position, that's just going to be amplified. And so, again, I think that's why bringing a alternative perspective into this, somebody who seems to have a good grip on individual rights, personal freedom, who may be able to convince the medical industry to go a different way, I think is my preference for this seat.
Well, I think we're only talking about Dr. Blue and Dr. Cole. Well, we had another really good applicant, Dr. Stan Moss. Great applicant. Now, he did come to the game a little late. He was we had established a June 30th deadline, and he come in when let's see what the date is on his application. It was after that by a week or so, and we granted that exception, but I don't think it gave him enough time to get himself known in the community as well. He's a retired orthopedic surgeon, but I was most impressed with his, because as you recall, I asked all three of them their top three priorities if they were to this position. I couldn't really get it out of Dr. Blue. I mean, his top priorities were public health. Well, okay, it's a public health board, and depends on the time. Well, and then COVID. He said was at least top three. With Dr. Moss, his top three priorities were educate people on the vaccine. I just suggested that was one of the main things that the board could do is educate people on the vaccine, help other board members understand the medical procedure and processes, and the most important thing is to get individuals to consult with their doctors. Dr. Cole, his was educate people on the efficacy and the benefits of a vaccine, but not only that, but the rest of the things that the health board does to treat all people with good access and bring calm and decency. I thought that was really good to bring calm and decency to the board and to the discussion. Now, I don't know why other doctors are attacking him. I mean, he had a fairly plausible explanation, and that is, well, follow the money, he said. I don't know how much that really would have to do with it, but I do think we shouldn't overlook Dr. Moss in this discussion, and we've seemed to overlook Dr. Moss because he would have more time than any of the other two. But anyway,
Well, Mr. Chair,
Yeah.
if I may, I've been thinking about this a lot and didn't sleep much last night, and trying to figure out how we can come to and instead of or. How do we get Dr. Blue and Dr. Cole and Dr. Moss to serve the community? Because I do think that is what is of most benefit, is to be able to take these various perspectives and skills and qualifications for our community. And so I think that we can see the writing on the wall that Commissioner Davidson is going to make a motion to nominate Dr. Cole. I would make a motion to not nominate Dr. Blue. And I'm not sure you'd second either one of those. So I'm gonna suggest an alternative here. I'm gonna suggest something probably completely out of the ordinary, but I think that this board has shown a willingness to collaborate on decisions, and not necessarily there has to be a winner or a loser. And I agree, Dr. Moss was an excellent candidate, and he is retired, and he does have respect and trust in the community, and he does have the relationships, and he does have the time to serve. And so I would be willing, actually, to make a motion to nominate Dr. Moss with the stipulation that when it comes to large-scale community health concerns like the pandemic, like the variant, that he consult with Dr. Blue and Dr. Cole, and that he becomes sort of the liaison of the three-legged stool, if you will, of what each of those professionals bring to the table. And then that informs us in a much more well-rounded, I think, fashion, because at the end of the day, legislation changed this year, and ultimately this board decides whether the policy that the Central District Health Board puts out is accepted or not by this board. So we have the supreme authority over the situation regardless. And so I would rather have all three of them serve our community and serve us. And I just think it brings the best of all worlds to the table. And I think Dr. Moss's personality, his temperament, really lends itself, I think, to be that sort of liaison. And again, I would love to see Dr. Blue, and Davidson would love to see Dr. Cole, but I think at the end of the day, we're just setting ourselves up to be more divided. And I think we've had enough division in our community, enough division in our state, that I think if we start to move towards collaboration, that's the direction we need to go. And this is a little bit of an unorthodox motion, but I would be happy to make it.
Commissioner Davidson.
It's an interesting idea. You know, I am looking at the fact that 90% of the emails that we've got in have specifically endorsed Dr. Cole. I think at this point, if I were to consider something like that, I would need additional time to hear from the same voters if this is something that they would support. So I don't think, if you wanted to go ahead with that motion, I would move to table this maybe till the next open business meeting, unless we have any legal deadlines, or we,
We have no legal deadlines whatsoever, because Dr. Epperly's term expired the end of June, and here we are in August. There is no legal deadlines. Furthermore, there's no requirement that this particular position be a doctor. There is a requirement that one, I read the law again. The requirement is one member of the district board, if available to serve, shall be a physician licensed by the State Board of Medicine. So I wouldn't object to, if that's what you want to do, to get some more discussion on that, if that's the direction you want to go. Would you object to that?
Yeah, Mr. Chair, I do appreciate public input, and that would allow us time, because we were flooded with emails the last few days. There was some emails that went out on social media, and our staff weren't able to keep up to let us know how many of those folks actually live in the 4 counties that are under CDH. And so people sending us emails from Oregon or Washington or Montana, whatever. I would probably want to know how many there are in the emails that we've received. So that would give us time to do that. In addition, I think that this is sort of an unorthodox motion that I would be making. And it does really kind of stipulate that these 3 doctors really work closely together. And they are very different and have differing ideas and philosophies. So I think it gives us an opportunity to reach out to each of them, maybe have all 3 of them in to talk to us about what that would look like. Because I think it's an opportunity to get the best of all worlds. Like I said, we can look at the and instead of the or in this situation. So I'd be willing to table this to a date next week.
Do we have a motion?
Okay. Judy, you want to give me a date?
Do you wanna do it at the next OBM?
Sure.
That would be the 24th.
Okay, I'm going to make a motion to table the appointment of the CDH appointment
Oh,
to
it'd be the 17th, sorry.
17th,
to
excuse
next,
me.
to next Tuesday, the 17th, in order to give this board a little bit more time to reach back out to the public that lives in the 4 counties and get feedback, and also to the 3 potential appointment nominees here. And anything else that we may need to gather in order to make the best decision possible for our community. And we're sorry for the delay, but this is such an important decision. We want to get it right. And if there's a way that we can, I think, bring all of these experts to the table, then we're going to work hard to figure that out for the community.
Okay, is there a second to that motion?
I'll second the motion. I don't know if I'm ultimately gonna change my position, but I think, doing some additional research into all the matters, specified by the motion maker is in order. You know, I don't know if it'd be preferable to have 3 voices instead of 1 voice, directing, especially if there's conflicting information on messaging, but, I do think that, since we're not up against the legal deadline, that we could table this till the next meeting. So I will second that motion.
All right, you've heard the motion. Moved and seconded to table this appointment till the 17th. If there's no further discussion, all those in favor say aye. Aye.
Aye.
Aye.
Motion carries.
And just one last comment on what Commissioner Davidson just mentioned. For me, anyway, looking at any decisions around science or medicine, I really believe that we shouldn't look at one doctor's opinion, that it really needs to be a collaboration of a lot of different sets of data, empirical data, opinions, and I think this maybe allows us to do a better job with that.
Just to reply, it may, but again, we have how many health districts across the state with their own doctors on there contributing to the knowledge pool as well as at the state level. So But we will investigate this and we'll come back and talk to you all again next week.
Hate to disappoint you guys.
You just have to stay.
All
Thank
right.
you.
All right, with that, we're in recess.